Did you know that something sitting in your bathroom cabinet right now, something your doctor prescribed, something you have taken 100 times without a second thought, could be quietly attacking the most important organ in your body? It sounds unbelievable. But according to leading cardiologists, certain medications that millions of seniors take every single day are doing exactly that. Not because they are dangerous drugs, not because they were prescribed incorrectly, but because after the age of 60, the body responds to them in ways most people have never been warned about. I am talking about 5 of the most common medications in the world. The pain reliever you took this morning, the stomach pill you swallowed with breakfast, the cold medicine you grabbed last week without reading the label, even the supplement you bought because you thought it was protecting you. These are not exotic medications. They are ordinary. They are trusted. And for millions of older adults, they are silently putting pressure on a heart that deserves far better. Tonight, we are going to go through all 5 of them. We are going to look at exactly what they do to the aging heart, why the risks are so much higher after 60, and most importantly, what you can do starting today to protect yourself. This is not about stopping your medications or panicking your doctor. This is about becoming the kind of informed patient who asks the right questions, makes the right decisions, and gives their heart the protection it has earned. Stay with me, because what you are about to learn could literally change the way you manage your health for the rest of your life. Before we dive in, if you have not subscribed yet, I recommend you hit that button right now and turn on the bell so you never miss another health tip made just for you. And, as always, if you find this video valuable, type the number 1 in the comments below. If you feel we can do better, type 0. Your feedback means everything to us here at Healthy After 60. Part 1. The 5 medications silently damaging senior hearts. Number 1. NSAIDs, the pain reliever hiding in plain sight. Let us start with the medication that is probably the most present in your daily life. The one that has been there for every headache, every aching back, every morning your knees refuse to cooperate. Non-steroidal anti-inflammatory drugs. You know them as ibuprofen, naproxen, and diclofenac. They are your most reliable solution for pain. They work quickly, or they work consistently. And, for decades, most people have taken them without giving it a second thought. But here's what nobody tells you. Taking these medications regularly after the age of 60, especially if you have any history of high blood pressure or heart concerns, is one of the most quietly dangerous habits a senior can have. Take the case of Robert, a 72-year-old retired teacher from Ohio. Robert had arthritis in both knees and took ibuprofen almost every single day to manage the pain. It felt like the most natural thing in the world. One afternoon, while working in his garden, he felt completely drained. His ankles had swollen to twice their normal size. By the time he reached the emergency room, Robert was experiencing acute heart failure. His cardiologist found no new disease, no blocked arteries. The trigger was the medication he had trusted for years. Dr. Stephen Greaves, a cardiologist with over 20 years of experience, explains what happened. NSAIDs block the enzymes that cause inflammation, but those same enzymes also protect your kidneys and your blood vessels. When you suppress them, 2 dangerous things happen at once. First, your body begins to retain salt and water. Your heart, already working harder than it did at 40, suddenly has significantly more fluid to pump. For a heart managing the natural stiffness of age, that extra load can push it past its limit. Second, NSAIDs constrict blood vessels and raise blood pressure. If you are already on blood pressure medication, certain NSAIDs can neutralize its effect completely, without your doctor knowing, without any warning sign, until the crisis arrives. According to the American College of Cardiology, regular NSAID use in adults over 65 increases the risk of heart failure by up to 28%. And here is the part that truly concerns cardiologists. Millions of seniors are taking these pills daily, completely unaware of that number. Robert recovered. But his doctor told him something afterward that changed the way he approached every medication from that day forward. He said, "The danger with ibuprofen is not that it is a bad drug. The danger is that it is a drug nobody respects. So what should you do? Do not suffer through pain. Do not stop without guidance. Simply bring the conversation to your doctor. Ask directly, given my age and my heart history, what is the safest pain relief option for me? Topical gels, acetaminophen for mild pain, at lower doses for the shortest time necessary. These are conversations worth having. But if something this common can quietly damage your heart, wait until you hear what your stomach pill might be doing, because this next one will genuinely shock you. If you are still watching and finding these insights valuable, comment the number 1 below right now. Let me know you are here with me. Number 2, proton pump inhibitors. The stomach protector with a dangerous secret. The second medication on our list is one of the most prescribed drugs in the entire world. Proton pump inhibitors, omeprazole, pantoprazole, lansoprazole. Brand names so familiar they have become household words. Millions of seniors take one every morning for acid reflux, for heartburn, to protect the stomach from other medications. Their doctor told them it was safe. Many were told to take it for life. But here is the bitter irony that most patients are never told. The medication prescribed to protect you from one risk may be quietly creating another one through the back door. Consider the story of Helen, a 68-year-old woman who was prescribed omeprazole for chronic acid reflux. She was told to take it indefinitely. Her reflux disappeared. She never questioned it again. Years later, during a routine checkup, her electrocardiogram showed something unusual. Blood work revealed the cause. Her magnesium levels had fallen dangerously low. Magnesium is the guardian of your heart's rhythm. It regulates the electrical signals that keep every heartbeat organized and consistent. When magnesium is depleted, the heart becomes electrically unstable, like an orchestra without a conductor, and dangerous arrhythmias can emerge. In severe cases, the consequences are life-threatening. The cause of Helen's deficiency was the omeprazole she had taken faithfully for years. Because stomach acid, which PPs are designed to suppress, is also essential for absorbing magnesium from food. Suppress the acid long-term, and magnesium absorption quietly collapses. Dr. Patricia Walsh, a gastroenterologist and cardiac health specialist, puts it plainly. PPI-induced magnesium deficiency is one of the most underdiagnosed cardiac risk factors we see in older patients. It develops slowly, it produces no obvious symptoms, and by the time it is detected, the heart has often been managing electrical instability for months without the patient or even their doctor realizing it. And the magnesium problem is not the only concern. Multiple studies have found an association between long-term PPI use and increased risk of heart attack. The proposed mechanism involves nitric oxide, a molecule that keeps your blood vessels flexible and open. Long-term PPI use appears to reduce nitric oxide levels. When nitric oxide drops, blood vessels stiffen. And stiff blood vessels are one of the primary conditions that set the stage for a cardiac event. Helen's story has a good ending. Her magnesium was restored. Her irregular rhythm resolved. She was carefully weaned off the omeprazole under her doctor's supervision. She said something in her final checkup that stayed with her cardiologist. She said, "I spent so many years protecting my stomach. It never once occurred to me to ask what that was costing my heart. If you are taking a PPI right now, do not stop abruptly. Sudden withdrawal causes a painful acid rebound. Instead, bring this to your next appointment and ask, do I truly need this long term? Can we monitor my magnesium levels? Is there a safer alternative for me? Now, if a stomach protector can quietly threaten your heart, you will not believe what a simple cold remedy can do. Because the next medication on our list sends more seniors to emergency rooms than most people could imagine. Number 3, oral decongestants. The cold remedy that can push a senior heart to the edge. Picture this. It's a weekday evening. You have a cold. Your nose is completely blocked. You drive to the pharmacy, grab the most familiar box you can find, take a tablet, and wait for relief. This is one of the most routine things a senior does, and for some, it is one of the most dangerous. On oral decongestants containing pseudoephedrine or phenylephrine, the active ingredient in most over-the-counter cold and flu remedies, can produce cardiac effects that are severe, rapid, and terrifyingly underestimated by the people who take them. Take Margaret, a 75-year-old retired school teacher who caught a severe winter cold. To breathe easier, she bought a well-known cold remedy with pseudoephedrine from her local pharmacy. She had taken it before, years ago, without any problem. By the second morning, her heart felt like it was trying to escape her chest. She was dizzy. Her head was pounding. When her son brought her to the hospital, her blood pressure had reached what her cardiologist described as a hypertensive crisis. She had developed a rapid, irregular heartbeat. The cause was that single decongestant tablet. 2 days of use. Dr. Raymond Foster, an emergency medicine cardiologist, explains why this happens. Pseudoephedrine and phenylephrine are vasoconstrictors. They work by narrowing blood vessels in the nasal passages to reduce swelling. But the drug does not stay in your nose. It travels through your entire bloodstream, narrowing blood vessels everywhere it goes. The result is 2 simultaneous threats. First, your heart must pump against dramatically greater resistance. Blood pressure spikes, sometimes dangerously. For someone already on blood pressure medication, this can override that protection entirely, sending pressure skyrocketing without any warning. Second, these drugs are stimulants, and they accelerate the heart rate and can trigger arrhythmias in people whose hearts are already electrically sensitive, which includes the majority of adults over 60 who have any degree of hypertension or cardiac history. Margaret recovered, but she said something to her doctor that should stay with all of us. She said, "I read the label. It said for adults. I never thought that after a certain age, adult means something completely different. If you are over 60, and especially if you have high blood pressure or any cardiac history, avoid oral decongestants entirely. Saline nasal sprays, steam inhalation, corticosteroid, nasal sprays that act only locally, these are the safer choices. Do not let relief for your nose become an emergency for your heart." Now we arrive at a topic that carries both stigma and enormous importance. Because the next medication treats one of the most serious conditions a senior can face, and yet its cardiac risks are almost never part of the conversation. If you are still with me and finding this valuable, please type the word important in the comments right now. Let us see how many of us are here together. Number 4, tricyclic antidepressants. When the medication for the mind threatens the heart. Depression in seniors is one of the most undertreated and most dangerous conditions in elder health. It raises the risk of heart disease, accelerates cognitive decline, and shortens lives. Treating it is absolutely essential. But how we treat it matters. and one older class of antidepressants still prescribed today, and often for chronic nerve pain rather than depression, carries cardiac risks that are almost never explained to the patients receiving them. Tricyclic antidepressants, amitriptyline, imipramine, nortriptyline, medications that still have real therapeutic value for certain conditions. But that, in the aging body, create a set of cardiovascular effects that demand attention. Consider the story of Frank, a 78-year-old man suffering from diabetic neuropathy, a constant burning pain in his feet that made sleeping almost impossible. His doctor prescribed a low dose of amitriptyline, not for depression, for the pain. And within 2 weeks, the burning had reduced significantly. Frank was sleeping again, but his family began to notice something. Every time Frank stood up from a chair, he would pause, grip the armrest, and wait before moving. And he said he felt dizzy when he stood. They assumed it was simply old age. Then, one evening, Frank stood from the dinner table, took 3 steps, and collapsed. He fractured his hip. The amitriptyline had been causing orthostatic hypotension, a sudden drop in blood pressure when moving from sitting or lying down to standing, a known side effect of this drug class, one that had never been explained to Frank or his family. Dr. Leonard Hayes, a spine and geriatric health specialist with over 30 years of experience, describes the full danger. Tricyclic antidepressants carry what I call a triple cardiac threat in older patients. They cause orthostatic hypotension, which leads to falls and fractures. They elevate resting heart rate, creating constant cardiovascular stress. And, most dangerously, now they interfere with the heart's electrical conduction system, slowing impulses in a way that can trigger very dangerous ventricular arrhythmias. Frank's hip required surgery, 3 months of rehabilitation, a complete medication review. The amitriptyline was replaced with a safer alternative, and his dizziness resolved within weeks. He said something in his recovery that his doctor has never forgotten. He said, "I wish someone had drawn me a picture of what that pill was doing to my heart before they handed me the prescription. If you or someone you love takes a tricyclic antidepressant, bring 3 specific questions to your next appointment. First, have safer modern alternatives been considered for my condition? Second, is my blood pressure and heart rhythm being regularly monitored? Third, has anyone assessed me for orthostatic hypotension? Your mental health and your cardiac health are not 2 separate conversations. They are one. And now we arrive at number 1, the most controversial and the most surprising medication on our list. Because, unlike everything else we have discussed, this one does not even require a prescription. Number 5, calcium supplements. The bone protector that may be hardening your arteries. For decades, the advice has been delivered with absolute confidence. Take calcium to protect your bones, prevent osteoporosis, keep your skeleton strong as you age. Millions of seniors buy calcium supplements without a prescription, without medical guidance, because they have been told for so long that calcium is simply good for them. But here is what a growing body of research is beginning to reveal. What you eat and what you swallow in supplement form are not the same thing. And for the aging heart, the difference may be far more significant than anyone prepared you for. Take Linda, a 70-year-old woman who was concerned about osteoporosis and decided to start taking a high-dose calcium supplement on her own. She had no significant risk factors. She did not smoke. Her blood pressure was well controlled. Her cholesterol was healthy. Several years later, she suffered a heart attack. Her medical team was baffled. When they investigated every possible contributing factor, one stood out clearly: the high-dose calcium supplement she had been taking daily, without medical guidance, for 6 years. Dr. Emily Rhodes, a geriatric specialist, explains the mechanism behind this concern. Calcium obtained from food, dairy, leafy vegetables, the fortified foods, is absorbed slowly and the body uses it efficiently. But a supplement creates an artificial spike of calcium in the bloodstream. The body cannot route all of that calcium to the bones fast enough. The excess has to go somewhere. And what concerns cardiologists most is that it appears to deposit in arterial walls, contributing to the calcification and rigidity that drives heart attacks. The research on this connection is still evolving. Some large-scale studies have found a modest but real increase in cardiac risk among high-dose supplement users. Others have not found the connection definitively. The science is not yet closed, but the lesson is clear. More is not always better. And choosing to self-prescribe a high-dose supplement for any reason, without a conversation with a doctor who understands your full cardiac history, is a risk that millions of seniors are currently taking without realizing it. Linda said something after her recovery that has stayed with everyone who heard it. She said, "I thought I was doing everything right. I thought taking extra calcium was just being responsible. Nobody ever told me there was a limit. If you have osteoporosis or are at risk, please do not take this as a reason to stop treatment. For many people, the benefit of protecting their bones is absolutely worth the risk. But that is a decision that belongs to you and your doctor, not to a label on a supplement bottle." Part 2. What to do with everything you have just learned. 5 medications, 5 stories, of 5 warnings that most seniors will never hear from their doctors. Not because their doctors do not care, but because there is never enough time in a 15-minute appointment to have these conversations. Robert, whose arthritis pill quietly pushed his heart into failure. Helen, whose stomach protector was draining the mineral her heart depended on. Margaret, whose cold remedy sent her blood pressure into a crisis. Frank, whose nerve pain treatment was silently threatening his heart's electrical system. And Linda, who did everything she thought was right and still walked into a danger nobody warned her about. None of these people were reckless. None of them ignored their health. They were doing exactly what they had been told to do. The only thing they were missing was this conversation. My message today is not panic. It is not stop your medications. Stopping medication on your own can be extremely dangerous, and I want to be absolutely clear about that. My message is empowerment. You now have information that most people your age will never have. Use it. The next time you sit with your doctor, come prepared. Bring a written list of everything you are taking. Prescriptions, over-the-counter medications, vitamins, supplements, everything. And ask the questions that matter. Doctor, I have learned that this medication may carry cardiac risks at my age. Is it still the best option for me? Are there safer alternatives? Should we be monitoring anything specific? Is there anything on this list that concerns you given my heart history? That conversation, simple, direct, and informed, is the most powerful act of self-care any senior can perform. Because here's the truth. Your heart has been working for you every single minute of every single day of your life, without a pause, without a complaint, simply keeping you alive through everything you have faced. It deserves the same faithfulness in return. So tonight, take a few minutes. Look at what you're taking. Write it down. Make the appointment. Have the conversation. And if this video helped you think about your health differently, please share it. Think about your parents, your neighbors, your friends who take these medications every morning without knowing what we discussed today. A single share could start a conversation that genuinely saves a life. These lessons are meant to inspire you to live fully and to act on what you know. Now I would love to hear from you. Take a moment and share one thing from today that you plan to bring to your next doctor's visit. Let us support each other on this journey toward better health. If you enjoyed this video, please leave a comment with the number 1. If not, feel free to leave a 0. Your feedback means everything to us. Do not forget to like, share, and subscribe to Healthy After 60 for more content like this. Thank you for watching, and here is to living your healthiest life, starting today.